worrying that we are much better than we were yesterday. Yeah.
And yes, Oscar.
Yeah, I just wanted to chip in a bit on the question you asked about the Council of Governors saying that this can burden them. No, we have also to make a decision. We have to decide whether we devolve health or not. But when the national government also does the policy, and now they're coming into, when they have these new people, this is implementation. And now the question is health really devolved? And if health is devolved, that means that, from what Kerry is saying about some counties are not able to even just pay. Currently, counties are only paying wages. The wage bill is just too much for them to manage. Now, the question is, if we decide to devolve wealth, some people are saying about, let's add 35%, because 15% we've seen 10 years of devolution, what 15% has been able to do. There is agitation to add more money to the counties. But if you add more services to the county, if you want to devolve health completely, you have to add more money to the health services. Secondly, apart from just adding more money, you must give the counties the right, the opportunity to do. When you come up with universal health, this is a policy level. But again, how do you involve the counties are going to manage it? It is going to be challenging in terms of implementation because it is not very clear policy. Because now we're adding 100,000. But look at your news in the next 3-5 days. Doctors are going on strike everywhere. Either in Nyamira County or Embu County, doctors are on strike. We cannot still be having these strikes of doctors striking, nurses striking, while we are adding more 100,000 to help in and we're going to pay those 100,000. Let's make sure that doctors don't strike anymore. Because even health, it should not be an occupation where you're even allowed to strike, because you're providing essential service to people in health. It's like telling me soldiers or the military are striking. When the military strike, that means that the country's at war. So when health workers are able to strike, how many lives do we lose? Even if health workers strike in a day, we lose a lot of lives. Because even transferring, there are patients you cannot transfer from one hospital to the other because they are on machines. So imagine these people are striking. These are a small number that are working in referral hospitals. Now down the level, if we want to do something, we need to involve the counties. We need to put more monies to the counties, and I think that 35% should go down. If the president is very clear that he really wants this health to work for us, as now we are doing Mashujaa Day, go back to Jomo Kenyatta's 3 pillars, ugonjwa, umaskini, na ujinga. What Mashujaa, or the 60th Mashujaa Day, we should be able to deal with one, and we should be able to deal with disease, for example. And if we come to history of what Mashujaa Day, even people don't understand the first time Mashujaa Day was celebrated. The first Mashujaa Day was celebrated even before independence, in 1958. And it was not Kenyatta Day. It was Mashujaa Day that was celebrated in 1958. 1959, Mashujaa Day was celebrated. And this 2010 Constitution, although people call it 2010 Constitution, we don't call it 2010 Constitution. This is the original Constitution we had at independence. We had the Senate, we had a Supreme Court then. We had all these things after independence. So when we brought in the Constitution of 2010, we just went back to whatever we had then, where the rain started beating us, right? And that Heroes Day was celebrated before then. It became Kenyatta Day in 1963, when now Kenyatta becomes the president, and now by law, the Constitution recognized 20th of October as Kenyatta Day for the first time. So Kenyatta Day was celebrated from 1963 to 2010. Then 2010 we reverted to Mashujaa Day, the Heroes Day, to now bring in all the heroes and recognize all the heroes who participated, not just Kenyatta, who was seen to be the leader of the revolution.
David, okay, you wanted to add something?
Let me just add in something important which I've noted from Arnold and Oscar's discussion. Arnold has been, his clarion call has been Article 43, and how the socio-economic rights are supposed to be exercised in this republic, and to start with health. And you compound that with what Oscar said. Just yesterday I was having a very interesting discussion with some of my students, and interestingly I teach labor law. What Oscar said is the aspect of there are some sectors which are not supposed to be unionized, or which are not supposed to go on strike. And the fact that he has mentioned that health, and you compound that with what Arnold is talking about, the constitution, then there is a missing gap. The missing gap is what he said, that we need to have our health sector to be taken well, to be taken care of very well, that they can also be removed from the list of people who can be able to strike. Because when you bring in the aspect of somebody who is in critical care, and then the doctors are on strike, the nurses are on strike, that person is literally dead. How do we ascertain, or how do we arrive at what Article 43 anticipates, that the highest attainable, this person's right to life has already been taken away by this action? So it's very important that we be able to look at things from that perspective, and even be able to ensure that the welfare of doctors is something we take to heart and deal with at the highest level, so that we can move them from the cluster of people who are allowed to exercise or enjoy their labor laws fully, but limit them to the level that we ensure that their welfare. You see, the police cannot be able to strike. The prison officers cannot be able to strike. They are off the list of
even
people and the KDF, they can also not strike. So if you can have the doctors and the nurses not being able to go on strike, but they are allowed to agitate for their right to welfare in a certain manner, like the soldiers do, and the police and the prison warden, then we will have actually satisfied the anticipation which is given in the constitution in attaining highest attainable levels of health care. Because otherwise we'll be speaking from both sides of the mouth. We have our Labor Act, which does not have the health professionals in that list of people who cannot strike. But we have a constitution which speaks boldly that, and the number one issue is health, attainment of health at the highest level in terms of achieving socio-economic development. Then how do we marry these two? Because the anticipation of the constitution is big, but the Labor Act and does not seem to pick the same spirit and implement the same. So I think in terms of policy development, that's something we ought to look at, that we can be able to have to exercise fully the right under Article 43.
Indeed, and David, still basing our argument on the framework that my colleagues here have also mentioned in regards to the laws. You know, looking at the universal health care, the trial or the pilot program that was in around 4 counties or 5 counties, 4 counties, it didn't quite work, because if it worked, we could have built on that. But the presidency had a sit down and also came up with the 4 laws that he assented to yesterday: the Facilities Improvement Financing Act, Digital Health Act, Primary Health Care Act, and the Social Health Insurance Fund, which will definitely replace the NHIF. How do we ensure that we do not fall into the same pitfalls that we fell with the universal health coverage in 4 counties?
Ndiye huyo kwenye hilo gari lake linaitwa nini ni kuambua?
Naam, bila shaka mtazamaji, msafara wake Rais William Ruto ambao umewasili katika uwanja huu wa Kericho Stadium muda mchache tu baada ya mkewe ama